My pleasure and privilege to welcome this year's rank 1 in the recently conducted Pediatrics SS, the INA SS. She secured rank 1 in the Pediatric Cardiology portion, and it's my pleasure and privilege to welcome Dr. Veena Bharathi to the show. Good evening, Dr. Veena.
Thank you, sir. Thank you. Good evening.
So, Veena, before we go ahead, could you just introduce yourself to us so that we get to know you a bit better?
I did my UG from AIMS Raipur. I am from Andhra, Vijayawada. UG from AIMS Raipur, and currently I am pursuing MD Pediatrics from Jipmer. And
so your first chance. So before you cleared your MD itself, you have got into the next level. So you've gone into the DM. Yeah. So it's a great achievement. Now you have your before you have cleared your MD itself. If you secure a seat, it's that great an achievement. So my question is, why did you choose pediatric cardiology? You could have chosen any of the innumerable specialties offered like gastro, neuro, nephro, or something like neonatology. Why did you specifically choose pediatric cardiology to attempt?
So cardiology was always it's like a lifetime dream branch, like thing. So since after my MBBS, during internship, I decided to take up medicine and do cardiology further. But I couldn't get into medicine and but ended up in pediatrics. But I really loved pediatrics. So I don't want to go to adult branch. I have a chance to go to do adult cardiology. But since I loved pediatrics, I don't want to go adult branch. But since I loved cardiology, so I think I'll do pediatric cardiology.
So, I always say that pediatric cardiology is completely different from adult cardiology. It's much more complex, and you really need to use your brains to practice pediatric cardiology. Adult cardiology says basically 4-5 diseases and maybe 6 or 7 drugs. So, were you exposed to pediatric cardiology during your MD days?
Yes, sir. We were exposed a lot. Usually, we'll get a lot of congenital heart disease cases, a lot of complex in NICU itself. You'll see a lot of complex heart diseases, and we will get to manage those cases also. So we had good exposure to pediatric cardiology.
So, I am basically an adult cardiologist. So, I look at pediatric cardiology from the outside. So, among what specifically attracted you? Like, was it the interventional part? Was the pediatric cardiology is also a heavy interventional branch nowadays? So they do a lot of PDA stenting. They do balloon pulmonary valvotomies. They do in fact all your cardiothoracic surgeries also get through the pediatric cardiologist. So what specifically attracted you? Was it the intervention part or was it the case management part? How was it?
So mainly the intervention parts, I should say, because I would like to do so many procedures. So interventions are the one which attracted me most to cardiology.
I think pediatric cardiology is an up and coming field in India. Compared to adult cardiology, there are a huge number of adult cardiologists and maybe around 5% of interventional, 5% of pediatric cardiologists when compared to the number of adult cardiologists. And there's a lot of cutting edge procedures happening in pediatric cardiology right now. So, so how was your experience in preparing for pediatric cardiology? How did you prepare for pediatric cardiology? What time did you start preparation for pediatric cardiology?
I had started preparing from this year starting.
So in your final year?
I said in my final year. Previously, I had an idea of how to prepare, like what I differently want. In second year itself, I decided to take up pediatric cardiology. Then I started watching videos in my final year, and I watched all the videos and made my own notes. And after reading those notes, after having basic understanding of the disease, then I went and read referred Park cardiology textbook. That will become easy for me after after watching videos and making notes and reading the notes. Then after that, I took grant tests and question banks. Question bank I did that.
So is actually reading Nelson because pediatrics now the entire every pediatrician reads Nelson. So it's not like medicine where every MD medicine graduate reads Harrison. It's a bit different. Every pediatrics PG reads Nelson. So is studying Nelson alone enough for prepare for the INSS pediatric cardiology part?
No, sir, not at all. Nelson's I read the CVS part completely, cardiovascular system part, but not full Nelson's I have read. Only CVS part I read, but that is not at all enough, sir.
Okay, so I think you need. Yeah, you even the exam questions exist beyond Nelson, right? A
Yes,
lot of
yes.
questions comes beyond Nelson. How can you estimate how many percentage of questions comes beyond Nelson?
And like
A rough
almost all,
estimate would be.
roughly around out of 60 will come from pediatric cardiology, 50 to 60. Out of
Okay.
that, 70% will be coming from out of Nelson's only. For that,
So
definitely we have to read our textbook
I think
from.
this probably holds same for other specialties also. So I think a message to all the aspiring pediatric cardiologists and probably other pediatric super specialties. I think most of the questions come from beyond Nelson, and I think you should go beyond that into your super specialty bits. So, like, how was your experience with the exam? Like, how many questions did you attempt, and
I attempted,
how many? Yeah.
I attempted 79 questions.
Yeah, okay. Out of 80, right?
Out of
Was it?
79 questions,
You attended 79 questions. So out of that, how much you estimate would be correct for you?
I got 56. That means around 62 were correct.
I think 62. I think a key message is I think you should attempt a lot of questions.
Yes, sir.
Some people just attempt around 65 questions or 70 questions and come. Consistently for all the topper interview, even in the medicine super specialties, people attempt more than 75 questions. And I
Yes,
think
sir.
almost all of you should attempt more than 75 questions and not stick on to something like 65 to 70 because you getting even the topper is secure on maybe on 60 to 62 questions have been correct for her. So I think you require to attempt at least more than 75 questions. But did you get enough time to complete all the questions? Was the question paper lengthy?
It's not lengthy at all. Question paper more of like a fact based, I can say. Like which statement is correct, which one is correct. So most of like a fact based things rather than
It was all
only
direct.
yes sir. Only some case scenarios are there. But general pediatrics part is like more of a case scenario based. If you do general pediatrics and if you attend clinical rounds well, you will be able to easily answer those general pediatrics questions. But
20 to
pediatric yes, sir. Around 20 to 30 were general pediatrics. But coming to cardiology, per se, is most of like a fact-based questions, and you should know everything. Echo also, ECG, echo, everything. Even fluoroscopy pictures after devices that are also they are keeping as a question.
So around how many image-based questions were there roughly?
Image-based only fluoroscopy, one question only they asked, sir. One ASD device they asked. And echo-based, one question they asked. One small VSD echo, they gave like a flax view they gave with the left
It's
right shunt and pulse
basically
net.
a simple,
Yes,
basically a simple
simple,
questions.
simple question.
So have you gone through the Marrow videos of pediatric cardiology? I think there are
Yes,
18 to 20 videos, right?
yes, sir. 18 videos with there. I have gone through everything and made my own notes. I use them for revision.
So how long did it take you to go through all those videos?
Actually, I'll watch every video in 2x speed. So it took a short time only, I think so, sir. I am not sure.
Okay, so maybe around a week.
Maybe around a week, sir. That's all.
Around a week. So how useful was the pediatric cardiology videos which were taken for Marrow?
It was very useful, sir. Basic things, how to approach a question and all. What is the basic pathology of the disease? Everything we got to know. Even the fact-based questions also, most of the things are covered.
So did you practice a lot of MCQs and where did you practice from? How useful was the Marrow question bank for you?
I practiced all MCQs from Marrow question bank only.
So did you go through the entire Marrow video lectures in pediatrics apart from pediatric cardiology?
Apart from pediatric cardiology, I watched general pediatrics. I thought it will be useful for general pediatrics and neonatology and certain other I watched just for my preparation for my MD exam so that it will become easy for me. I watched
How,
neonatology, I watched the things I did.
so regarding the overall Marrow SS Pediatrics, how useful is it for for a regular pediatrics PG?
It is very useful, sir. I have not gone through everything, but definitely it will. So many algorithms also are told. Some endocrinology videos also, so many algorithms will be. And if someone teaches us, we'll remember it more. So it will be useful in our day-to-day practice.
So, Dr. Veena, how useful is Marrow as for a regular MD pediatrics PG, like from first year, second year, third year? How useful is it for you?
It was very useful, sir, because a lot of things which if we teach, we'll remember more. A lot of algorithms were taught, a lot of approaches will be taught. So if we know those things, that will be useful in our patient management also. Some better understanding we will be having if someone teaches us.
So I think one of the great advantages which all of you guys had, which we did not have, let's say maybe when we did our DM around 10, MD around 10 years ago, was like, we were forced to read books. You have alternate sources. You have people actually reading a lot of super specialty books, reading a lot of your standard pediatrics books, and then coming up with a class for you and giving you concise, crisp information, which is probably also very useful for your clinical practice. I think that is
Yes,
one great advantage which a video-based learning platform actually offers. So,
yes.
in hindsight, when do you think you should start preparation for your INSS pediatrics?
That once a person decides definitely you want this field only, that time itself they can start preparing. There is no like timeline and they can start
How
preparing.
long do you think you should prepare? Like, should you start in the first year itself? Because I see PGs, starting at first year itself. So, should you start in first year itself, somewhere in second year or final year itself is enough?
Secondly, final year is also enough, sir. But other than that, basic pediatrics understanding also they should get rather than just teaching or reading about cardiology. Because we have to manage the patient as a whole. So a lot of general pediatrics also needs to be included. We should know each and everything about growth, development, everything we should know to manage a patient as a whole. So whenever they feel like preparing for it, they should prepare for it. Along with it, general pediatrics also should go hand in hand.
Any particular areas which need to be covered apart from this, what you said, long QT, maybe around your QT pathies, apart from that, any particular areas?
Brugada syndrome and fetal cardiology also. One or two questions
Fetal.
they will. Yes, sir.
All right. Exactly. So I think one dictum is you will never be a good, say, super specialist or subspecialist if you don't know your specialty very well. You have to manage patients as a whole. The patient doesn't read a textbook and comes to you. He doesn't tell you
Yes,
it's a cardiology case. Might be a respiratory case with a certain degree of cardiac symptoms.
yes,
So how was your overall experience with the Marrow platform, with the Marrow app? Did you use Marrow during your MBBS days when you prepared
yes,
for your MD?
yes, sir. I used Marrow only for my research preparation also. So it was a very good platform. Nothing, no need of any improvement in the platform. So that is very good, sir.
I think you have upgraded from your. We have a lot of students who use Marrow during their MBBS and now they are using during their MD. So I think you have rank one. You have a huge choice of colleges. I mean, the seats are of course limited, but the colleges, each of those colleges have seats, at least one seat. Where do you plan to take your INM DM in pediatric cardiology from?
It's Delhi, sir.
AIMS Delhi, excellent institute. That one of the top, probably the topmost institute in India, and it's all the best. And I think I wish you will have a great career ahead, and become a very successful interventional pediatric cardiologist. And
Thank you, sir.
hopefully we get to meet in some cardiology conferences. So
Sure, sir.
thank
Thanks.
you for your words, and hopefully future PGs, if you're watching, you will take inspiration from her performance and from her strategies. Thank you.
Thank you. Thank you so much.